First, let me start by saying thank you. I'm so grateful for not only the clinical excellence of our Mount Nittany Health leaders and employees, but also for your resilience and courage in facing the challenges of an unprecedented year. Time after time, you rose to the challenge in caring for our staff and community, even though you yourself were faced with adapting to the change of new roles and responsibilities, new teams, and uncertainty. We asked a lot of you, and you knocked it out of the park. Many of you have shared with me that while the past year has brought previously unimaginable challenges and unprecedented hardships, it also enabled Mount Nittany Health's legacy of excellence and you to shine. And I can tell you that I hear from our community that the trust in Mount Nittany Health and the importance of our role is stronger and more apparent than it's ever been. Repeatedly, patients and colleagues share stories with me about the compassion and competence of our teams. I could not be more proud of your display of leadership and how you all approach the delivery of healthcare for our patients and our community every single day. As we look forward to the future of Mount Nittany Health, we know there'll be challenges ahead, but I'm fully confident that whatever comes our way, you're up for the challenge. That gives me great joy and hope for our future. Today we'll spend time looking forward to our role as a strong healthcare system serving communities with healthy people, but we also want to pause and reflect on the year we'll never forget and on how it has changed us personally and collectively. So sit back and enjoy as our leadership colleagues and friends share their personal experiences.
I manage the critical care services for Mount Nittany Health. Several times over the last year, we stood up the COVID units to care for the increasing number of patients who needed us. It's hard. It takes an amazing multidisciplinary team to put up the units and ensure that they are safe and ready for patient care. It was also tough for our staff, gearing up every day and night to go through those double doors to fight the pandemic. It was not only physically exhausting to care for patients and each other, but also emotionally exhausting. To know that people didn't believe it was real was painful too. We did everything that we could to educate the community through videos, newspaper articles, and ads. It was important that our staff have an outlet to implore the community to help us. I am so proud of the team that I lead. They care deeply for each other, their patients, and our community.
It's been hard. We have a lot of really good people here at Mount Nittany Health, people who care, and they need leaders who are willing to fight through the tough stuff with them. Leaders who will take the heat on things that matter. Many times over the last year, it mattered that our employees, as well as our docs, knew that we were in the fight with them, fighting the pandemic with them. People have heard me say about character, not being able to be forged in times of crisis, but rather it's revealed. And day after day, time and time again, we saw that in so many of our people. I try to keep things pretty simple. As we recover from what we've learned and what we've experienced, I guess I'll kind of bring it back to one of my papisms that people have heard me say. Let's try to take care of each other. Let's try to be a little bit better than yesterday. There's a new good, and we're going to get there.
The pandemic, We've never seen anything like this in our lifetime. Early in the pandemic, we didn't know what we were facing, but as emergency healthcare providers, we had planned for the textbook version of a pandemic. A key strategy is to care for those sick with COVID while eliminating the risk to others needing emergency care. We quickly stood up an alternate care structure outside of the ER and outfitted it with all the necessary equipment to ensure that staff and patients were safe. As the pandemic progressed, our processes and screenings evolved. That outdoor structure has become one of the iconic images that represents the intensity of what we were dealing with and continue to manage for a very long time.
Managing PPE in a pandemic. The entire world was scrounging for masks, gowns, face shields, and other protective gear. Through years of planning, we had a good supply of PPE on hand, but every hour we saw that scarcity was becoming more apparent as demand soared. Hundreds of items, including masks, face shields, testing needs, and basic equipment, became difficult, if not impossible, to find. We didn't know when the hardest days would hit us. We needed to be prepared. My team did everything they could possibly do to continue to secure pandemic-related supplies for those on the front lines. We would real-time communicate to the COVID preparedness team our daily status. Although sometimes unpopular, decisions were made real-time on the pandemic updates that our team provided. Our job was, and continues to be, to make sure that everyone has what they need to be safe, and we never take that lightly.
In the spring of 2020, we knew that we needed to efficiently test our patients for COVID in a safe outdoor environment. Our physician group and lab set up test collection sites in Mifflin County and here in State College at Blue Course Drive and for our pediatric patients in Boalsburg. Winter weather was the catalyst to eventually transition our care to the parking garage. I'm very proud of how quickly and safely we cared for our community.
Telehealth and virtual visits were something that we had been working on for a long time. In the spring of 2020, we were faced with the challenge of caring for our patients in a pandemic environment. The safest plan was to keep as many patients at home as possible. So quickly, with the help of many in IT and other departments, we began to offer virtual visits and telehealth to our patients. What was once a consideration for our patients soon became the go-to. Now that we are open, some of our patients are more likely to use this option for care. But I will never forget how quickly the teams acted to continue care for our patients.
In the early days of the pandemic, we knew two things. The community trusted us, and they needed as much information and education as possible on all fronts. In response, we immediately worked with Dr. Joshi to create a weekly Facebook Live event that reached hundreds of thousands of people. It was coupled with media relations and other support. We set up award-winning assets, including a COVID social media series, videos, and a virtual gratitude website. We even coordinated a fire truck parade at the health system to recognize our teams. The pandemic forced us to pause before we launched our refreshed brand and ask, did the work really reflect the courage of our physicians, nurses, and staff? Did it honor our patients and our community? The answer was not quite. So we went back to work. The result was Courageous at Heart, and we poured everything we learned and felt into it. You've seen a year's worth of work so far, a new website, videos, posters, and ad, and we're just getting started.
The MNH Analytics team interviewed and conducted discovery sessions with key stakeholders across the health system to develop select dashboards to provide end users with sanitized, pertinent, dynamic, and near real-time data. The first dashboard that we deployed was the COVID-19 summary dashboard, which included data on current positive COVID patients, patients under suspicion, patient demographic data, and much more. The next dashboard that we put in production was the Work RVU dashboard, which enabled end users to view Work RVUs by department, provider, CPT code, and historical comparisons. We continue to perfect and improve upon these dashboards because enhancing reporting, informational outputs, and broader analytics capabilities is paramount to my team and the organization. I am incredibly proud of the work that we've accomplished with these initial dashboards, especially as these data points met a critical need for our providers, staff, and the community.
As a leader in human resources, I make it my personal mission and that of my team to always be available to every employee, regardless of the issue or situation, to answer their questions, hear a concern, or sometimes just to let them vent or cry. I am proud that this year we offered COVID paid time off to support our employees, We aligned health, dental, and vision benefits across the system and reached a fair, sustainable agreement with our bargaining unit. As we continue to focus on our employees as our strongest asset, I'm excited for what the future holds and what this means for the quality of healthcare for our communities.
In less than a few weeks, our teams prepared to deliver what would be more than 45,000 doses of COVID vaccine in less than 5 months, providing each and every dose to members of our staff first, then to our partners in healthcare, and then to the most vulnerable in our community was a gratifying experience. I'll never forget the look on my own grandmother's face when I walked into the room after she had just received her first dose. I'm sure you all have your own story that is similar to mine. Although the beginning stages of requesting vaccine were challenging because we never knew how much would be allocated to us, I am forever grateful to have been part of the process. I'm also incredibly thankful to my supervisors, who in my opinion are some of the best stewards of the vaccine, and for my pharmacy team for making the dose preparation look easy. We are truly a part of history.
We were a part of history. Our challenge was to make it better, faster, and easier for people to sign up for a COVID vaccine. We used the system that's often used in restaurants to let people know when their table's ready. And we were actually one of the first health systems to sign people up for a COVID vaccine using this method, and then notify them when it was their turn. I was grateful to work with the team that was united in our efforts to make this difficult time better for the people of our community. It mattered that we used the tool that eased people's minds, that they were going to get a vaccine. To help people in a time like this is rewarding.
Our challenge was to accurately and efficiently manage the information of thousands of people with a new process and an unpredictable vaccine delivery timetable. In the early days, we didn't know how many vaccines we'd give or when. But one thing was always clear: people in our community were counting on us. They were equally terrified and grateful. We worked day and night for them. We scheduled and registered thousands of patients to ensure that the process was safe, accurate, and fast, and checked the boxes for all reporting entities. We were a part of history, and there were many working together to make that happen.
Over this past year, we planned for and transitioned to a new biomed and work order request system called True Assets. Any database transition can be a major undertaking, but this switch also meant changing all of our workflows, something we're still actively working on perfecting. This new platform allows us to perform preventive maintenance measures through the system rather than manually as we used to. It's made our data more accurate and reliable, which in turn has made our reporting process more efficient. The proper function of our equipment is absolutely vital in enabling our staff to care for their patients. They need to know they could count on their equipment, especially this past year. My team takes this responsibility very seriously, and the implementation of tools like True Assets help us do that work even better.
In fiscal year 2020, as our teams were fighting COVID on the front lines, we were behind the scenes ensuring that we were doing everything possible to secure our portion of the Federal CARES Act funding. This was quite the process, but it mattered to be sure that we were capturing every dollar that was available to us to invest back into our employees, our community, and our future.
Having a baby and celebrating every moment is a treasured memory. The first moment that a sibling meets their sister or brother, or grandpa holds his grandson, is part of the experience that we provide. On the Women and Children's Unit, we celebrate with moms and extended families every day. But it was different this year. I am proud of the way that my team went out of their way to create those special memories for a generation of babies that were born during a pandemic. And now we're building a new space, expanding our unit to double the size as more and more people trust us with their first moments as a family.
Being a brand new nurse, just coming out of nursing school, is hard. We hire the best and the brightest, but the first months of nursing career can be some of the most difficult. To ensure success of our graduate nurses, we initiated the nurse residency program so that our grad nurses are supported by a team of leaders to learn our processes and programs, but also have each other as they navigate their first year with us. Each small group cohort allows for engaging conversations and dynamic learning. So far, we have 30 nurses enrolled in the program and are looking forward to more. This is just one of the many ways that we are investing in our most valued asset, our people.
A reflection on the last year. It's difficult to put into words all that our employees, our health system, and our community experienced over the past year. As the IPAC manager, it's been my responsibility to advise on all things COVID, including policies, PPE, communications, COVID units, vaccine rollout, and safety. It's been a time like no other, and we learned a lot as an organization and as a team and about ourselves. I hope that we will continue to draw from our experiences to stay vigilant against COVID and to recognize how much our community continues to count on us for their care.
When people need surgery, it's a day they plan for weeks, sometimes months. And this last year, as a surgical team, we were making very tough calls when our COVID census was too high to allow for elective surgeries. A surgery never feels elective to a patient. It's the relief from pain or part of a treatment plan to improve their quality of life. It was a daily process, and it required a lot of communication with the surgeons and patients. We're getting back on track, and we're looking forward to new, exciting patient care advancements. You can continue to expect a lot from our surgical team.
First, I'd like to say how very proud I am to be a part of this leadership team and of everyone in our physician group as they serve our patients every day in our medical practices in our community. Safely delivering care, especially in the early days of the pandemic with so much unknown, was truly impressive. It will take generations for the stories of this past year to be told. I'd encourage you as a leader to reach out to a doctor, an APP, or any of our colleagues in our practices and tell them how much you appreciate them. Anyway, while we were caring for our community, the positive aspects of our health system were amplified. Since the onset of the pandemic in March of last year, we've recruited and hired 22 physicians and APPs to Mount Nittany Health during this time, in specialties like weight management, psychiatry, and spine surgery, and we're continuing those efforts. I'm very grateful to everyone on the team that I continue to work with. Our medical group is growing stronger every day, and I'm so very proud of each and every one of them.
We faced so many challenges during the pandemic, but one thing that just always comes back to me and just impresses me and makes me so happy to be part of the Mount Nittany family is in every single one of those moments, our teams were 100% focused on taking care of patients and taking care of the community, as well as trying to balance taking care of their own people, their own family, and their own community. And to see that level of commitment in the healthcare team was actually magnificent and something that I always reflect on and know that this is one of the best places to be, and I couldn't be more proud to be on this team.
Being in anesthesia, typically we are well trained. We understand what we're up against most of the time. During these last 18 months, it's been totally different for us. We've been faced with many changing conditions, sometimes on a daily basis within a shift. Sometimes your working conditions were changing. And as a team, we would keep pushing forward, making sure that we were trying to provide the best care for our patients. Early on in the pandemic, there was a lot of uncertainty, and a lot of us were had some apprehension about how to care for these patients. And as we started to gain more experience, knowledge, as evidence started to be produced surrounding the pandemic and how to care for these patients, we started to gain confidence in ourselves and, make sure that we were maintaining a positive work environment when it was very difficult to do so. And I found that that was very important within our department. I can tell you that a bright spot for me personally was when we started our vaccine clinic here, and I was able to go from taking care of patients in the beginning of the pandemic who were looking to us for hope as they were going under for an emergency procedure or going on to a ventilator as medically necessary, to be on the other end of it, to be offering a vaccine to members of the public, to offer them hope, to kind of put an end to what the pandemic meant for them.
The most defining moment for me for COVID was that until we had large number of patients admitted and until we actually had to shut off an entire wing with COVID patients, you kind of had it in your mind from news, from seeing each separate patient individually. But when I went to the COVID unit the first time and I put the gear on and walked in, I felt that I was really in a different world. It's something that's indescribable. I felt I was kind of science fiction movie. The isolation, the loneliness, patient being in the room by themselves, just suffering for every breath. And even though the staff was there to console them, to be there with them, but the human touch, people in the room wearing all this gear, to me, that's when it struck me how horrible this is, that somebody gets dropped off at the hospital, the emergency department with a pneumonia, and next thing you know is that they died the death that nobody wants, being alone in a cold hospital room without loved ones, without the human contact. And that was a defining moment for me that, this is just something that is so horrible that I hope that we never have to see it again in our lifetime.
This past year, fundraising became more challenging while the need became greater than ever. Through the hundreds of personal conversations we were able to have with community members, we heard the fear, sadness, and at the same time, the gratitude that was widespread. People shared their fear of getting sick, of a loved one getting sick. They shared their sadness of not being able to see their family members, and they shared their emotional, sometimes even tear-filled gratitude whenever they finally were able to receive their vaccine. Gratitude from our community resulted in almost 20,000 pieces of PPE and over $250,000 in donations that have helped keep Mount Nittany Health strong and resilient in our fight against COVID-19. It has been an honor to be a compassionate voice from our organization, connecting with our community, and to support the courageous workers at Mount Nittany Health.
I had only been here probably less than 2 months, and I'm in a meeting and we start seeing all the news come across the television and the radio, and basically the increase in the COVID kind of permeating throughout the United States and around the world. And we set up our incident command center right then and there, and just started making preparations for testing, for how we were going to treat folks when they arrive at the hospital, and so that was kind of one of my first earliest moments, even with the organization.
One of the things that I'm particularly passionate about is the vaccination effort that we've had here at Mount Nittany. The vaccines have been proven to be safe and effective with a vast amount of information that's out there. And I've been fortunate to be a part of that effort here at Mount Nittany, where we've vaccinated greater than 45,000 individuals, which is great. I do have a little souvenir. So at the beginning of all of this, when the vaccines were first starting, these are the vial tops from just actually a portion of the vaccines that we have collected here at the hospital. I knew that this was going to be a piece of history, truly, that is like a physical manifestation of like our efforts with what we're trying to do to protect our community. So I wanted to save these. I'm not entirely sure what I'm going to do with them yet, but I have some ideas, and I'm really excited just to have this tangible representation of what we can do as a pharmacy, what we can do as a hospital, and what we can do to support our community. The hard part for me now is really having the tools to be able to fight, to be able to do what we can to protect our patients, and then to still see patients who are having bad outcomes because at this point they've chosen to be unvaccinated. That is really, really tough because I really do want what's best for my patients. I want what's best for my community, and I want what's best for my nation. And I really do feel like vaccination is it.
It's hard to find one distinctive moment that defines the COVID pandemic for me, but I am very proud of the human resources team and the leadership across Mount Nittany Health who came together to make sure that our employees were safe during this time and that they had the appropriate PPE that they needed to remain safe, that they had extended COVID PTO time to care for themselves and their family, and that we were able to expand employee testing for the COVID-19 virus.
My COVID story, let me first state that I am not a frontline worker, but I have the utmost respect for our healthcare workers and our employees that are frontline workers, from nutrition and culinary services to the ER, to the physician group, critical care, all the nurses on the floors. I have the utmost respect for them. In employee health, we receive phone calls every day from our employees that are frontline workers, and we hear about what they're going through. For instance, PPE, you think something as important as that, you wouldn't think twice about it, but wearing it day in and day out on their face, they have to make a nice tight seal. Sometimes they develop irritations and skin rashes where it becomes difficult and even painful to wear, but they endure that just to take care of the patients and also to protect themselves. And then every day we receive calls from employees that are experiencing symptoms. Some are mild, some could be symptoms that are similar to allergies or the regular cold or flu. And employees are they don't know what to do. They feel that they don't want to call off because they don't want to leave their coworkers in a bind. But yet they don't want to, if they do have COVID infection, they don't want to bring it to their coworkers or to their patients. You just feel so bad for them that they're having to deal with all of this. So they are the real heroes, in this organization. And I hear their stories every day and what they go through. And just to, take care of our patients and our community. And again, I just have the utmost respect for them. And I'm just so happy that I get to, work with people like that at Mount Nittany.
Most impressive thing has been our staff, the staff with the nurses who have been here with patients in their dying moments when families can't visit, holding hands, the support staff who clean up the rooms after COVID, deliver meals. Everyone in the building is doing their very best, trying to be cheerful and supportive of a lot of folks who are pretty sick with COVID. I think, I've always felt that this job is a lot about relationships between people, and whether you're taking care of someone or you're collaborating with a colleague. And I think the hardest part about COVID is COVID takes a lot of that humanness and puts a barrier between it with our protective equipment. Our protective equipment saves our lives, but it does take some of the human quality out. And I think it's hard on patients and it's hard on staff. Many people go into medicine to care for people. And when you're all gowned up and gloved up and masked up, it's hard to have that human touch. But I think our staff has done the best they can in the situation to make that happen.
Hi, I'm David Dahl. I'm a psychiatric counselor on the behavioral health unit at Mount Nittany Medical Center. And I would like to share with you my COVID story. And it involves a number of heroes. The first hero is my wife, Tina. She was a physician and she worked in forensic medicine. And she contacted COVID. And as be it, I was COVID positive, and our son Jason was COVID positive. We all got symptoms at the same time. As this story unfolds, you'll find how COVID affects people in many different ways. Okay. So I was really sick for about 4 days, and then I recovered. So the science says, since I did have the first vaccine, that maybe I had the antibodies to help with that, so I recovered. Tina progressively got worse. Jason got real bad to the point he almost had to get hospitalized, and he was an athlete. So I take Tina to the hospital. I was COVID positive too, so they had the ER had a nice setup where they allowed me to take her in, and then I said, she said, well, she said, I'm scared, and I said, well, I'm scared too, and I love you, and she loves you. And then I had to leave. Okay. So that was the last time I saw my wife alive. She was here on the COVID unit for about 8 days. The staff, they were wonderful. So they're my heroes too. I think with any case like this, I'm sure they've learned a lot. And in learning what they have, I'm sure it's helping with cases moving forward. I must say that the staff, and when I'm talking about the staff, I'm talking about from an administration down to the physicians, to the clinical people, they were absolutely wonderful. You're all my heroes. What you did after the passing of Tina, not just for myself, but for my son Jason, that was very special in my heart. And when I was sharing my appreciation to some of the staff that took care of Tina, they said, don't worry about it, David. You're family. Okay. That's something that we don't always look at when we work in a facility as large as the medical center. But we are a family. I was shown I was a family. I share that feeling that I'm a family. So this whole experience has been, very challenging to me and my friends and my family. But what's got me through this very challenging time is the love and support that I've been getting through my friends and my family, and I consider my family my work family. Not just on the behavioral health unit, they were something else too. They're my heroes too, in helping me through this very challenging time.